So as I discussed in the intro, the pandemic's impact on mental health is becoming increasingly apparent. And we've gotten several emails on this topic. One of them is from Michael, who writes, as we go into the 7th month of the pandemic, many people realize Dr. Osterholm was right. It is not a winter storm, but a season. But it was troubling to me that a patient that I saw this week told me she was losing hope. This patient just celebrated her 65th birthday and 5 years of being cancer-free. We had a great conversation about hope and not giving up. She left the office hopeful, but what worries me is how many people are feeling the same way. Then we also received an email from Kai. Kai wrote, in light of World Suicide Prevention Day, which is today, September 10th, how should we go about achieving a balance between addressing our COVID-19 pandemic and our mental health epidemic? So Mike, everyone is focused on the physical impacts of COVID-19, but the mental health aspects of it can't be ignored. What do we know about how people are being impacted?
This is an incredible challenge that we have, not just the virus, but all that the virus is doing to us as a society and us as individuals. And this is also one that we all often don't want to talk about. Mental health is one of those very difficult areas to talk about. And yet we all have some sense of mental health, either very poor or hopefully very good. So let's just take a few moments and talk about the mental health issues versus the physical issues of this virus. It is very real. There have been several recent studies published, one in JAMA just published this past week, a study done by the Boston University School of Public Health, Brown University, Columbia University, and the Hazenfield Child Health Innovative Institute, where they really looked at a population-based surveys of adults 18 and older. And they compared what's happened since the pandemic began with a year ago with the data set. The data set from a year ago is the NHANES, which is the National Health and Nutritional Examination Survey. And they had quite comprehensive information on the mental health of 5,065 individuals representing the population of the U.S. And then they compared it to a population-based study that was conducted March 31st to April 13th, which they had 1,470 adults. Now, I want to make a point because the period of time assessed in March, April surely was a challenge, but it wasn't even the big challenge yet of what we've seen with the cumulative course of this pandemic through into September now. I think a lot of people who kind of thought this was going to be over with by May or June had one sense of this, and now they see this dragging on. But in the results of this study, a well-done study, they found that if you looked at depression symptoms, and they characterized them in the amount of the symptoms you had, it was either none, mild, moderate, moderately severe, or severe. And if you looked at before COVID-19, last year's survey, 75% of the population had none, no. However, only 47.5% had them this year. And remember, again, this is an earlier survey. This isn't with all the fatigue that is set in. A 27% difference. If you looked at mild, a year ago, 16% were mild. This year, 24.6%. Moderate, 5.7% a year ago, 14.8% this year. Moderately severe, 2.1% a year ago. This year, it's 7.9%. And in very severe depression, 0.7% a year ago, 5.1% now. I could go on and talk about all these issues around depression and but the point is, it is real, it is substantial, and it is growing. In another subsequent study that was published not long ago in August was one from the CDC, which in this particular study, they too looked at adults. It was 5,412 adults, again, randomly across the population. This study and the JAMA study will be on our website, so you can go look at these. But while the authors of the CDC study say the results from that study may not be directly comparable to results obtained from similar studies in previous years, there is a significant amount of information that can be gleaned from these studies. For example, in the second quarter of 2019, 8.1% in a previous study reported anxiety, where it was 25.5% of the participants in the second quarter of 2020. Depression for those same time periods went from 6.5% to 24.3%. Over a quarter of all the respondents in the study, 26%, reported a trauma or stress-related disorder somehow related to the pandemic. And what's really concerning is 13.3% have now started or significantly increased substance use to cope with the stress or emotions related to COVID. And we know what happens with chemical and substance abuse. Finally, 10.7% of the respondents reported serious consideration of suicide in the past 30 days, which is 2 times higher than what was reported among U.S. adults in 2018. These conditions clearly were disproportionately affecting specific populations, including young adults, Hispanic individuals, Black individuals, essential workers, unpaid caregivers for adults. Some of the groups already were at heightened risk for becoming infected, essential workers, and are facing more severe adverse outcomes from their infections. In a sense, this is almost a double whammy. The emotional, mental health issues in these populations, then having to be faced with going into the workplace every day to be exposed. And so you can understand why they're kind of hand in glove in terms of issues. And one of the things that this report says that the findings highlight the need to prevent and treat these conditions. However, we know access to mental health care has been a challenge in this country, and it has not gotten better in recent years. It's clearly has been exacerbated by the pandemic due to heightened demand, and yet the inability to have the one-on-one kind of therapy session. And this is going to only increase the needs for more mental health capacity. In a recent Kaiser Family Foundation publication on mental health, they demonstrated that nationwide, nearly 117 million people are in mental health provider shortage area, and less than 30% of the need for psychiatrists is being met. Furthermore, if you look at HRSA projects, there'll be a national shortfall of over 12,500 adult psychiatrists and over 11,500 addiction counselors by the year 2030. And another area of real importance is that pediatric providers are particularly problematic, with 70% of the counties in the U.S. having no practicing child psychiatrist. So the challenge we have before us is immense in terms of where we're at. And today I just wanted to share a sense of where I think we're at and going. Right here in Minnesota, we know that we have over 735,000 Minnesotans who do not have consistent access to enough food. Think about that. Think about 735,000 just in our state. And I think that's, if you're a parent, if you're even an adult without children and you're wondering where my next meal going to come from, where is it going to be, how absolutely difficult that is, particularly if you've been employed most of your life and suddenly you lost your job with the pandemic, and even with the financial support you're getting, it's not been sufficient, and now you're sitting here without the financial support, waiting to understand what they're going to do in Congress. So let me just take a step back and say, when we look at the mental health issue, we must have help. We must have help. We must seek help from a professional or a friend, if nothing else, to talk to us about this. And, I've tried to summarize this in kind of my own words. I am not an expert in mental health. You all know that. You can take whatever I have to say for whatever it's worth. It's about probably as much as you're paying for this podcast is probably what it's worth. But let me share with you, in a sense, what I feel and what I think, because I've struggled through this situation. And I think that I've come upon really, I think, several categories of what we have to address. There are 4 of them: fear, hope, loneliness, and exhaustion. And, fear comes into play so often when they say, I'm afraid. Others will say, don't be fearful. Don't be afraid. Take control. And that's easier said than done. And so I agree with that notion. Fear comes upon us and leaves when we have courage, when we can actually take something on. But the fear of the virus is real. It's very real. I hear people say, I'm afraid to go back to the gym. I'm afraid to go to the grocery store. And what they have to do is begin to understand what they can do to protect themselves, how they can protect themselves, what kind of facial coverings to use, how much time, what is their overall risk in terms of having a serious illness. Knowledge will help deal with fear. I have a job loss. I'm going broke. I have no money. I can't pay for putting a roof over my kids' heads. That's fear. Loss of friends. I can't tell you how many times in the past several months I've had conversations with people who all but break down into tears because people who are friends, people who are loved ones, family members, they are now almost bitter enemies over this issue. I actually had a history professor from a college here in the United States share with me a couple weeks ago. He said, as many years as I've been teaching Civil War history, I never understood what it could feel like to be a parent where half my sons went and fought for the North and half for the South. And in my family situation, he said, right now, over this COVID issue, that's where we're at. That's really hard. You heard Mike talk about the issue of hope. It's a challenge right now between the political sense of where we're at, the pandemic. We will get through this. It could be a while, but we're going to get through this. And if anything else, I hope this podcast family helps each other get through this, because we got to be there for each other. And that means that sometimes, one broken leg on this side, one broken leg from somebody else on the other side, but we got two whole legs in the end, okay? So let's do what we can do to get through this by helping each other. As far as the loneliness, in so many ways, as bad as fear is, and loneliness is the cruelest of all. Learning to live with this virus, don't let it control you. Figure out how to be outdoors and a way where you can still socialize with people. We've already talked about the infectious dose issue. If you got grandkids or kids, go hug them. 30 seconds to a minute and then back off. Don't hang on them. Don't let them hang on you, but don't not see them. Figure out how you might even take pods, where three of you are basically sequestered in your apartments or your homes, but you get together every day if you can, because you don't see anyone else. But you make sure you reach out to someone who's just like you. Connect with friends. This is a day and age where phone bills are not a big problem, largely. Talk. Reach out to friends and see your family. This is a time to reach out where families in the past may have been distant, and maybe it's not possible to reach out to some because they're going to be part of this whole problem of agreeing or not agreeing with what's going on. But reach out to people. Finally, exhaustion. And this one, I'm not sure I'm so good on right now. Many of us are exhausted, really exhausted. But you know what? We can't give up. And it's going to get worse. It's going to get worse. The days are going to get darker. It's going to get colder. The virus isn't going to go away any soon. But we have to decide we're going to get through this. Find new ways in your life, new hobbies. Exercise. Even if it's literally doing laps around your kitchen table at home if you don't have any other place to go. And see how high you can get before it drives you crazy. Reach out to others, again, from an exhaustion standpoint, and talk about it. Not to complain, but just what are we going to do to get through this? And you know what? Plan a goal. Maybe it's to read like you've never done. Maybe it's that 40-year cleaning your house that you were going to do that you never did. Maybe you take up a new hobby of plants, horticulture, whatever. Just do something. Don't let exhaustion let you just sit there and feel exhausted. And one of the ways I think comes back to this is, let me just summarize and say, I think just be kind and be forgiving. Forgiving is a hard thing right now, particularly when some things are so in your face. But just forgive. It's too much of a burden, and I have to do that. There's times when I don't know how I'm going to do that, but I have to. And just be kind. Just be kind. Exercise if you can. I said walk around the tables if you can't. Walk outside. Go for walks right now if you can. If you live in an area where it's not safe to do that, actually find that friend I talked about who can pod with you, and maybe they can drive over and pick you up, or you can drive and pick them up. Don't be afraid to seek therapy. Even if it's distance therapy, telemedicine, do it. I've been in therapy my entire adult life, and thank God I've had Linda to be there for me. She's been incredible. I've learned a lot. And so I want all of you to know it's okay. Don't be ashamed. Don't feel like it's somehow you're less someone because you do that. Seek that out. And know if you're feeling really rough right now, you're normal. That's your problem. You're normal. And many of us feel that way. So, we're at Sid Rapper here for you. We're going to do the best we can. Our podcasts, our information is power with this virus. And I do understand what we have here. I get it. We see the communications every day. A lot of us don't get it right. I surely don't get it right, as I've said to you many times. But I think this podcast today is me asking you to let us be part of your family and you part of ours. And it's why, because we need it. It's not about facts. I got all the facts in the world I could want. But what I want and what all of us want are that feeling of connection, that feeling we're going to get through this. And by God, no virus is going to rob us of that. So I conclude to say, be kind. I can't say that enough. That is by itself the first grease in the gears of moving forward with our lives. And when you find you're spending more time trying to be kind than you are fearful, lonely, or exhausted, the world will look a different color.